Hi, my name is Roslyn, and I will be doing my presentation on Adderall. So what is Adderall? Adderall is a combination of two central nervous stimulants, amphetamine and dextroamphetamine. It increases norepinephrine and dopamine levels in the brain, which helps with staying more focused and less impulsivity. For this reason, it is used to treat ADHD in both children and adults. It is commonly used among students, and because Drug Enforcement Administration considers it a highly addictive drug, it is classified as a Schedule II controlled substance. So the picture on the right shows specifically what areas of the bodies are affected. Over time, Adderall can raise your heart rate as well as your blood pressure, which can cause damage or weaken the cardiovascular system. The lungs may also be damaged, which would result in reduced lung capacity, possible pulmonary disease, and trouble breathing. As for the muscles in the digestive tract, they tend to slow down, which can lead to gastrointestinal issues such as abdominal pain and constipation. While Adderall is a drug that needs to be prescribed, here is a short video of someone I know that is taking Adderall and just like to share her experience and like to share some helpful tips. So Vanessa, when you started taking Adderall, how did you prepare yourself for it?
I did my research on the side effects that I might get, and some of them were stomachache, loss of appetite, and feeling sleepy in the middle of the day. So I made sure that I had a nutritional and like protein-filled breakfast in the morning, and then I also tried to improve my sleeping patterns.
So what advice would you give to students, specifically in college, who are about to start taking that medication?
I would suggest to do your research on the medication and your own symptoms to learn how they show up for yourself so that you can manage them along with the medication. And then also improving your eating and sleeping habits so that it helps the medication. And then also reducing any alcohol use or any other kinds of drugs so that you can really see a difference in how it's helping you.
So Vanessa, know the facts. While Adderall is a drug that needs to be prescribed only for people with ADHD, there are people that don't have ADHD that do take advantage of the effects. Common abusers are late middle school students, high school students, and college students. They start to abuse it because it helps them focus with all their readings and assignments that they have to get through. And it's usually the students who take it legally that sell the pills for $5 each to other students. And some interesting statistics, 1 in 8 teens report misusing Adderall and Ritalin at least once in their lifetime. About 1.9 million teens said they have abused Adderall or Ritalin in the past year. 1 in 4 teens believe that prescription drugs such as Adderall help with studying. About 1/3 of parents believe that a child's performance could improve with ADHD even if it is not prescribed. Consequences of misuse and abuse. So when people use Adderall for a non-medical issue, they experience a bunch of negative outcomes such as trouble sleeping, irritability, change in appetite, extreme fatigue, and depression, which in some cases can lead to thoughts of suicide. There are also psychological effects such as drastic mood swings and personality changes where a person may become more violent, more paranoid, and more erratic. In some severe cases, people may even experience panic attacks and psychosis, which may include delusions or hallucinations. And that is the end of my presentation. I hope it was very informal, and thank you so much for listening.